Well, welcome to today's update. It's Sunday the 5th of December. Now, I've just been preparing today's talk and I must say I felt really quite a palpable sense of relief at the material I've been going through, and it's largely from South Africa. Now, I'm going to give you a very quick pre-say for you soundbite people that need to dash off and do something else. So just the first few minutes and you'll get the gist, and then we'll go on to the full detail with references, of course, as we always do. So the summary of this situation here is there's been an examination of 166 patients admitted with COVID, or not admitted with COVID, but found to have COVID in hospital in South Africa since the Omicron variant arrived. And there's also data from a snapshot of 42 patients on the COVID wards in the Steve Biko Hospital in Pretoria in South Africa. This is the absolute epicenter of where this started. So this is really the sentinel information we're getting here. What is happening here in South Africa will be happening all around the world in 6, 7, 8, 9 weeks time, that kind of time frame. So this is an anticipation of what's going to happen everywhere. The proviso is that as we said yesterday, there's quite a lot of HIV in South Africa, but I think this data is looking good. And in fact, if anything, the data looks better because of the HIV in South Africa, strangely enough. So it's these two things: 166 patients and a snapshot of 42 patients on the COVID wards at Steve Biko Hospital. The majority of hospital admissions are for diagnoses unrelated to COVID-19. So most of the patients in hospital with COVID-19 were diagnosed for something different. They were just picked up. The SARS coronavirus 2 positivity is an incidental finding in these patients and is largely driven by hospital policy requiring testing of all admitted patients to be tested, of course, because you need to know if they're going to spread it to everyone else. So they've found a lot of people who were admitted for other medical reasons who, hey, they seem to have SARS coronavirus 2 as well. 76% of the patients are incidental COVID admissions. So 76% of the patients with COVID were just found to have COVID in hospital. They weren't admitted for COVID-related complications. This is really very reassuring news. And the South African authorities are saying this is a very unusual picture, and it's also occurring at other hospitals in the Gauteng region, which is again the region where this all started in South Africa, even though it probably came from Botswana. The high proportion of COVID incidental admissions may reflect higher rates of community transmission compared to previous waves. Now, I haven't got full data on this, but I've been looking at this morning, and the sewage surveillance in South Africa, the prevalence of new infection has just gone off the scale. It just seems to be absolutely huge. This Omicron variant is just completely exponentially taken off in South Africa and in most provinces now. It's absolutely huge number of community incidents. Now, the good point about this, of course, is that means we're going to get massive herd immunity really quickly. And that's why this is one of the reasons this is so encouraging. But anyway, getting back to the direct communication from the South African authorities. So it's absolutely taken off. May reflect higher rates of community transmission compared to previous variants. So the first three waves, it wasn't as fast as this. This was absolutely taken off. There's massive transmissibility of Omicron. But that's not translating into higher admission rates for a primary COVID-19 diagnosis. This is just brilliant news. So there you go. That's the main points of today's talk, if you're short of time. So prevalence absolutely taking off in South Africa, no question about that. We know it's Omicron from various sources. The actual hospital concerned here, the Steve Biko facility, they can't actually detect whether it's Omicron or not directly, but we know that the South Africa fourth wave is Omicron from numerous other sources. So let's get down to the detail now, because the bottom line is that people aren't being hospitalised with this anything like as much as we'd feared. Therefore, there's going to be rapid herd immunity at minimal hospitalisation, and this could be the same all over the world. This is what we've been hoping for and sort of predicting on this channel, to be fair, for the last week now. And so far it's coming to fruition. So far it's looking good. Now, it could change. This could change in the next 2 weeks. tens of thousands of people all over South Africa could start getting ill tomorrow, but it's not looking like it so far. So far it's looking remarkably promising, and I'm hopeful that this is going to be maintained and we're going to get massive herd immunity all over the world at minimal cost in morbidity and mortality. Right, let's get down to the detail now. So Tshwane district Omicron variant patient profile early features. So this is what they reported. Now this was reported yesterday, 4th of December. So this is straight from the South Africa Medical Research Council. Do check it out for yourself there. The article I've got this from is absolutely brilliant. That's it there. Click on it. It's completely 100% readable to anyone. I just read through it with ease, and anyone could read through it with ease. It's not in technical jargonese at all. So Omicron in South Africa is what this is about. Now there's been a significant rise in new SARS coronavirus 2 infections in Gauteng province in the last 4 weeks. No question about that. That's a simple statement of fact. It's absolutely taken off in that area. Now just for orientation here, I've just given us a quick map because I'm not that familiar with South Africa geography. So this is all of South Africa here, of course, and here's Gauteng province here. It's where Pretoria is. There's a lot of people live there in cities, so that's where we are, and they're the other provinces in South Africa. Then the increase has been attributed to Omicron variant, which was announced on the 24th of November 2021, not too long ago, but yet so much has changed in that short time. The first cases of Omicron were detected in the Tshwane district. Now, I'm sorry about my pronunciation, so we'll get them better. In the Tshwane district. So this really is the sentinel. The rest of the world is going to follow in the same trajectory as this. I don't think there's any question about that. There's no question in my mind that Omicron is going to spread around the world and become the dominant variant. So the city of, this is just background information, the city of Tshwane Metropolitan Municipality is the metropolitan municipality that forms the local government of Northern Gauteng province in South Africa. So Tshwane is in this Gauteng province. The metropolitan area is centred on the city of Pretoria with surrounding towns and localities, population 2.7 million. So that's a lot of people. We're getting a representative small sample of patients from this population of 2.7 million. And the relatively low numbers of hospitalisations for the size of the population and the prevalence of the disease already is in itself reassuring. And what I'm going to tell you now is getting even more reassuring than that. So this is where the fourth wave started. So where this area has led, the rest of the world is going to we believe the rest of the world is going to follow on. Now Tshwane has become the global epicenter of the Omicron outbreak. Cases rising exponentially over several weeks, 41,921 cases by the 3rd of December. Now we do know from sewage and other data that the real number is probably 10, 20 times this, way higher than this. These are just officially diagnosed cases, so the real number is way higher than this. This is absolutely taken off in this area and other areas of South Africa. 9,929 new cases reported on the day in the 24-hour period. I think that was for Friday, I think. Anyway, Steve Biko Academic Hospital, Tshwane District Hospital Complex in Pretoria is where this information is coming from. Now these are the let me get rid of me a minute. These are the new daily cases. There we go. Tshwane daily cases. So this is the increase in the cases. But of course these are officially diagnosed cases and represent only the tip of the iceberg, but we can still see a clear rapidly increasing trend day on day, 1st, 2nd and 3rd of December. And this is in the heart of the Tshwane district. So the Steve Biko Hospital really, in other words, is the epicenter of the epicenter. It's the hospitalisation hub for the epicenter of the disease. Statistics presented by the Gauteng District Health Authority Department of Health on the 2nd of December 2021, written up as we said on the 4th. For the province as a whole, with admissions across all public and private hospitals. So this is collecting all of the data really that's available in that area. Sharp increase in admissions, yes. there is a sharp increase in admissions. Now, between the 14th and 29th of November 2021, 166 of these admissions were found to be COVID positive. So there's a lot of people being admitted, but most of the people with COVID, it's an incidental finding of COVID. These are being admitted with other conditions. Now, is there something about the this is interesting. Is there something about the Omicron variant which is stimulating or triggering exacerbations in previously existing conditions, causing the increased admission? That could well be. But what we know is that the majority of people that are being diagnosed are incidental diagnoses when they're admitted for some other medical condition, is what we know. So 166 new admissions with COVID. Patient information presented here only represents the first 2 weeks of the Omicron wave in Tshwane. So this could change, as we said, this could change. The clinical profile of admitted patients could change significantly over the next 2 weeks. Direct quote, that could happen. But we'll look at reasons why I'm reassured as well. But by which time we can draw conclusions about the severity of the disease with greater precision, of course. But there are reasons I'm optimistic already. The main observation that we have made over the last 2 weeks is that the majority of patients in the COVID wards have not been oxygen dependent. Now, the reason I am quite optimistic about this is that these patients are already being treated with steroids. Now, of course, the South African doctors know that you absolutely don't give steroids in the first part of the illness, in the viral illness. You give steroids to suppress the inflammatory reaction caused by the body's immunological reaction to the virus that causes the COVID pneumonia and the acute respiratory distress syndrome and the other complications. So the fact that these doctors are giving steroids means that the doctors are happy that they are not in the initial stages of the disease. Therefore, I would not expect this group of patients to suddenly relapse. They are in their danger period now. Let's go on with information. Majority of patients have been not oxygen dependent. So these patients are not needing lots of oxygen. They are not needing lots of oxygen. Really good news. SARS coronavirus 2 has been an incidental finding in patients that are admitted to the hospital for other medical or surgical or obstetric reasons. Now here's the list that they've got here. So this is patients on room air, this is patients on oxygen, and these are the COVID wards. So the male ward, 17 patients with COVID, 4 on oxygen. Female ward, 16 patients with COVID, 5 on oxygen, the rest on room air. High dependency care, intensive care, as you would expect, 3 on non-invasive ventilation. They're obviously on oxygen. So, but to be fair, these are the figures that you would expect on any medical ward in any hospital. These sort of number of people being oxygenated is not out of the way, not by any means. A snapshot of 42 patients on the ward on the 2nd of December, this data. So 29 of the patients, 70% are not oxygen dependent. So we have hospitalized patients here diagnosed with SARS coronavirus 2, and most of them are not oxygen dependent. These patients are saturating well on room air. Now what this means is that their blood is saturating with oxygen. They are getting good oxygen saturations, as we looked at with the meters. They're getting good oxygen saturations just on room air, the same as you and I are now. They're just breathing normal room air. In fact, we write that, we'll write the percentage, or if the patient isn't on oxygen, we just write RA, room air. It's this again. This is sort of international hospital sort of standard policy. They're saturating well on room air. They're doing absolutely fine on room air, and do not present with any respiratory symptoms. So most of these patients are not presenting with respiratory symptoms. They're incidental admissions, having had another reason for admission. 13 patients are dependent on supplementary oxygen. So some are, of which 21% of a diagnosis of COVID-19 pneumonia. So there is some COVID pneumonia here, but it's much less common than previous waves. All are being prescribed steroids as the mainstay of their therapy, indicating they are already in this inflammatory phase, already in their dangerous phase, which is good news. Well, it's good news because it means they're not likely to relapse because they're already on steroids. They're already in the complicated, dangerous part of their illness. The remaining 4 patients are on oxygen for other medical reasons, just happened to be on it anyway. This picture was not seen in previous waves. So they're being quite clear. This is based on talking to the nurses and doctors around this hospital. Okay, you could say that's anecdotal, it is anecdotal, but these are people that of course lived and suffered and worked phenomenally hard during the first 3 waves, and they're saying this is noticeably different in the sense that it's noticeably better. Right, so past 3 waves, there's only been a sprinkling of patients on room air in the COVID wards. So in the past 3 waves, it was very unusual for the COVID wards to not be on oxygen. So there's only a sprinkling of patients on room air in the past. Number of patients in high care on double oxygen, high flow nasal oxygen or non-invasive ventilation were noticeably higher in previous waves. This is anecdotal but confirmed by numerous clinicians who have previously worked in the COVID wards in the hospital complex. These are not inexperienced clinicians. Of the 38 adults in the COVID ward on the 2nd of December, interesting now looking at vaccination status, 6 were vaccinated, 24 unvaccinated, 8 were unknown. Of 9 patients with COVID pneumonia, 8 are unvaccinated. 1 is a child, and only a single patient on oxygen was fully vaccinated, but the reason for oxygen was chronic obstructive pulmonary disease. This patient needed oxygen because they had chronic obstructive pulmonary disease, which is the most common indication for giving oxygen. We give masses of this in hospitals, and indeed many patients with chronic obstructive pulmonary disease are maintained on oxygen therapy at home, so not at all surprising. So nothing like way less oxygen requirement in this Omicron wave compared to the previous 3 waves is what we are seeing. But also important to note that the vaccine is providing a high degree of protection against severe disease, albeit from that limited data set. Analysis of 166 patients admitted from the 14th to 29th of November. 80% of the admissions were below 50. This is getting younger, but it also reflects the fact in South Africa that the vaccinations are more of the older population is more heavily vaccinated. So 80% of the admissions were below the age of 50 in the population where the vaccines are not as commonly taken up. 19% were children aged 0 to 9. We looked at that as a concern, but the children don't seem to be getting sick, and we have no reports of deaths, thankfully, in children at all. 28% of total hospital admissions, 30 to 39-year-old. So the 30 to 39-year-old age group, which has a low vaccine uptake in South Africa, was the most common age to be admitted. So more people in the 30 to 39-year-old age group were being admitted than in the older age groups. And this really is a wake-up call for vaccine uptake in these groups around the world, because Omicron's coming. You and me are going to be exposed to Omicron pretty soon. In the next month or 2, you and I are going to be exposed to Omicron. We have to be ready for it. And this would indicate that vaccination is an important part of that preparation, as is good health, as is good nutrition, as is vitamin D status, of course. But it is coming. It's just a pity that the authorities in the States and the United Kingdom aren't using aspiration routinely. If that was happening, I think we'd have a lot more vaccine uptake and a lot less complications, subject to confirmatory data, of course. Anyway, that's my view. So there you go. Younger age groups really need to be thinking about vaccination all over the world, because if you're between the ages of 30 and 39 watching, you're going to be exposed to Omicron in the next few months, unless I am very much mistaken. In hospital death rate, 10 deaths in the Steve Biko complex in the past 2 weeks. 6.6% of the 166 who were diagnosed with SARS coronavirus 2 have died. 4 deaths were in adults aged 26 to 36, but the thing is, we don't know what they died of yet. We don't know yet whether these deaths were COVID related or not. We simply don't know. But given that most people were admitted for reasons other than COVID, it's reasonable to guess that at least a good few of these deaths were for non-COVID related reasons, but we simply don't know that yet. In fact, you would expect the majority to be non-COVID reasons, but we don't know, so we'll leave that there. But it's not. It's still looking hopeful. It doesn't distract from the general feeling of hope that I have from this data. 4 of the deaths were in adults, 26 to 36. 5 deaths were in adults over 60. 1 death was in a child whom the cause of death was unrelated to COVID. So here we go. This is a really important point. There's been no deaths reported in children from COVID so far in the Steve Biko Hospital complex from Omicron in South Africa. Let's hope it stays that way. But so far it's looking good. So the child tragically died, but it was some non-COVID related reasons. There were no COVID related deaths among 34 admissions in the paediatric COVID wards over the last 2 weeks, so brilliant, no children have died, that's good. Gauteng province as a whole. Now here we have let me get rid of me and show you this graph, because this really is a pretty amazing graph. So what we have here is the these are the previous waves. So we can see the first wave, the cases went up, and then with the delay, of course, the deaths went up. Second wave, cases went up, then with the delay, of course, the deaths went up. Third wave, the line there is when vaccination started, so cases went up massively due to vaccination, even though the vaccination status in South Africa is not that good, not that high. Still, the deaths were nothing like as high. Now, the cases are going up. Cases are going up, but the deaths are way down. The deaths are way down at the moment. And I'm just going to show you that on the blow-up so far. So here we have it. The cases are going up now, but so far the deaths are going down. So it really is so far so good in this South Africa situation. Of course, it could change, but there's no indication that it is going to change dramatically at this stage. So that's the really reassuring graph. Cases of Omicron going up even more than this is saying, and but deaths, which we know about, the deaths are definitely low, even though the cases are much higher than we are officially reported. So nearly done for this data. Level of care: only 2 patients in the COVID ICU in the last 14 days, so not many people needing high levels of care. Neither of whom had a prior diagnosis of COVID pneumonia, so again looking really good. Much shorter average length of stay on the Omicron 4th wave. So far the average length of stay is 2.8 days for SARS-CoV positive patients admitted to COVID wards over the last 2 weeks, compared to, and look at this difference, this is spectacular, 8.5 days for the past 18 months. So the average for the first 3 waves is 8.5 days of hospitalisation, and the average for the Omicron wave so far is 2.8 days of hospitalisation. This is remarkably encouraging, and I think that's probably about enough there. So so far this data from South Africa is very encouraging. We are seeing non-respiratory symptoms. We are seeing patients who are not, most patients who are not requiring additional oxygen. Most patients are not oxygen dependent. The oxygen demand is way lower than in the previous waves. The patients are getting out of hospital quicker. The patients are not requiring high levels of care, and most of them were picked up incidentally. So what this means is our initial hope that Omicron, while it's massively contagious and is taking off in South Africa and will take off around the world, that is happening. But our hope was that because it's so good at a lot of the genetic variation is kind of used up, as it were, to make it more transmissible, there's less left for making it more pathogenic, and that is looking like it is. It is looking like it is the case. It's looking promising. Now, what this means is the Omicron variant will, I believe, spread all around the world. As people are exposed to it, they will generate immunity that is specific to the Omicron variant. It looks like people are going to have very minimal disease. Now, because there's going to be so much Omicron everywhere all at the same time over the next few months, That could mean that, of course, a proportion of people, as we saw in South Africa, will be admitted to hospital. So there could be increased hospitalisations in the United States, in the UK, in Europe, Canada, Australia, everywhere, over the next month or two, but this should be within manageable levels. And the patients, we are hoping, are not going to be too sick, and we would expect mortality, while it might not be absent, we would expect it to be much lower. But that would be the price that would be paid for massive herd immunity developing really quickly, which would essentially be the end of the pandemic. So there we go. That's what the data is telling me at the moment. Thank you for watching.